Do you know, what is the leading cause of death in human? A hint for you. According to World Health Organization, this disease is responsible for 16% of the world's total deaths. If you guess about that, so please comment the name of that disease. Okay, I'm telling about heart attacks or cardiovascular diseases. The world's biggest killer is ischemic heart disease, responsible for 16% of the world's total deaths. Cardiovascular diseases, CVDs, taking an estimated 17.9 million lives each year. More than 4 out of 5 CVDs deaths are due to heart attacks and strokes, and 1/3 of these deaths occur prematurely in people under 70 years of age. So, think about that. Why this number of people are dying by this disease? While the medical science is so modern, how can you save yourself and your family from this disease? If you want to know more about this disease, so please see the video till end, and if you like our work, please subscribe our channel. So, let's start. What is heart disease? Cardiovascular diseases or CVDs are a group of disorders of the heart and blood vessels and include coronary heart disease, cerebrovascular disease, rheumatic heart disease and other conditions. A heart attack is said to have occurred when the blood flow to the heart is interrupted for some reasons, or the blood cannot reach the heart. There are several reasons why blood cannot reach the heart. Fatty, cholesterol-containing deposits build up over time, forming plaques in the heart's arteries. If a plaque ruptures, a blood clot can form. The clot can block arteries, causing a heart attack. During a heart attack, a lack of blood flow causes the tissue in the heart muscle to die. A less common cause of heart attacks is a lack of oxygen, hypoxia. If levels of oxygen in the blood decrease due to carbon monoxide poisoning, or a loss of normal lung function, the heart will not receive enough oxygenated blood. This will result in the heart muscles being damaged, triggering a heart attack. Many times it happens, when the blood pressure or blood effect increases a lot, the heart cannot pump properly in a certain rhythm, then the heart stops working, which can also result in heart failure. A heart attack is also called a myocardial infarction. In such a situation, the question arises that why the incidence of heart attack is increasing while doing gym? Most of the cases, the answer is hidden in our lifestyle. Nowadays most of the young people are taking steroids in the name of protein powder to keep their body muscular and fit. It directly weakens the arteries and veins of your heart. When a person exercises more, the heart starts pumping faster and the blood flow increases, the pressure increases but the heart is weakened, it cannot keep up with the blood flow and this leads to cardiac arrest. Lack of sleep at the right time and being under stress are also some of the causes of heart attack, and because of this, people associated with IT sector, night duty person are more prone to heart attack. Because they have to work late into the night, spend a lot of time under stress which results in them not getting proper sleep. There are many people who like to eat junk food or fried food more, cholesterol or fat accumulates in them, due to which the arteries and veins of the heart become narrow and weak. And if more cholesterol accumulates, heart attack occurs. Cocaine and amphetamines are stimulants. They can trigger a coronary artery spasm that can cause a heart attack. A lack of physical activity, sedentary lifestyle, is linked to a higher risk of heart attacks. This is a combination of at least 3 of the following things: enlarged waist, central obesity, high blood pressure, low good cholesterol, high triglycerides and high blood sugar. Having metabolic syndrome makes you twice as likely to develop heart disease than if you don't have it. Blood sugar rises when the body doesn't make a hormone called insulin or can't use it correctly. High blood sugar increases the risk of a heart attack. Emotional stress, such as extreme anger, may increase the risk of a heart attack. Symptoms of a heart attack can include chest pain, a feeling of pressure, heaviness, tightness or squeezing across your chest. Pain in other parts of the body. It can feel as if the pain is spreading from your chest to your arms, usually the left arm, but it can affect both arms, jaw, neck, back and tummy. Feeling lightheaded or dizzy. Sweating, shortness of breath, feeling sick, nausea, or being sick, vomiting, an overwhelming feeling of anxiety, similar to a panic attack, coughing or wheezing. The chest pain is often severe, but some people may only experience minor pain, similar to indigestion. While the most common symptom is chest pain, symptoms can vary from person to person. Some people may have other symptoms such as shortness of breath, feeling or being sick and back or jaw pain without any chest pain. When to see a doctor? Get help right away if you think you're having a heart attack. Take these steps. Call for emergency medical help. If you think you're having a heart attack, immediately call 911 or your local emergency number. If you don't have access to emergency medical services, have someone drive you to the nearest hospital. Drive yourself only if there are no other options. Take nitroglycerin, if prescribed to you by a healthcare provider. Take it as instructed while awaiting emergency help. Take aspirin, if recommended. Taking aspirin during a heart attack may reduce heart damage by preventing blood clotting. Aspirin can interact with other drugs. Don't take an aspirin unless your care provider or emergency medical personnel say to do so. Don't delay calling 911 to take an aspirin. Call for emergency help first. What to do if you see someone who might be having a heart attack. If someone is unconscious and you think they're having a heart attack, first call 911 or your local emergency number. Then check if the person is breathing and has a pulse. If the person isn't breathing or you don't find a pulse, only then should you begin cardiopulmonary resuscitation, CPR. If you're untrained in CPR, do hands-only CPR. That means push hard and fast on the person's chest, about 100 to 120 compressions a minute. If you're trained in CPR and confident in your ability, start with 30 chest compressions before giving 2 rescue breaths. Hands-only CPR, chest compressions. To do chest compressions on an adult, place the heel of your hand on the breastbone at the center of the person's chest. Place your other hand on top of your first hand and interlock your fingers. Using your body weight, not just your arms, press straight down by 5 to 6 centimeters on their chest. Repeat this until an ambulance arrives. Some important things to avoid heart attack. Do a medical checkup and check the endurance of the heart. And go to the gym as advised by the doctor. Do not exercise with excessive weights. Take short breaks while walking on the treadmill. If the body feels tired while doing the gym, then stop the gym like that day. Avoid the habit of sleeping less and sleeping late at night. Sleep at least 7 to 8 hours a night. Stress can damage the heart as well as the brain, so try to live a stress-free life. Take yoga and meditation in the morning to avoid stress. Exhale in the morning. Never use steroids to get toned or muscular from the gym or workout. Do not consume protein powder without doctor's advice. Also, taking supplements or non-essential hormone medications is not good for the heart. Eat foods that are low in fat and low in sugar and high in fiber, such as cucumber bread, crackers, etc. Do not smoke and drink too much alcohol as it increases the risk of heart attack. From the age of 30, get your medical checkup every year like heart, blood pressure, cholesterol and sugar checkup. Stay healthy yourself and advise others to stay healthy. If you like the video, don't forget to share it with everyone. Thank you.